But with Tylenol, don't take it. Don't take it.
Why do you think Trump said in this speech that we shouldn't use Tylenol and that its use should be limited? I hope you are doing well. I am Dr. Etemadi, dentist and specialist in gum surgery and implants. In this video, I'm going to talk about Tylenol, or Acetaminophen, the medication many of us use for fevers and headaches, and explain what connection exists between this drug and autism in infants. So if you want to learn more about this topic, make sure to watch this video all the way to the end, and rest assured that the information I share with you here will definitely surprise you. And I kindly ask that if this is your first time visiting my channel, please make sure to subscribe and don't forget to like the video. Well, almost all of us have experience using acetaminophen or Tylenol. It's a medication we can get over the counter and use to control fever and pain. And based on studies conducted so far, it has been shown that this medication is safe for pregnant women, has no effect on the fetus, and we can confidently prescribe it for pregnant women. On the other hand, autism is a neurodevelopmental disorder that affects the behavioral and communication skills of those who have it. Its exact cause is still not fully understood, but there are a number of factors that are directly linked to it. For example, alcohol consumption in women and pregnant mothers, also the use of anticonvulsant drugs, infectious diseases, and most importantly, genetics are among the factors that are directly associated with the development of this condition. But why has the drug acetaminophen also been listed among the factors that cause autism? It all started with studies that showed that children with autism had mothers who had a history of taking acetaminophen during pregnancy. Various mechanisms have been proposed for this. For example, researchers have suggested that acetaminophen can cross the placenta and cause damage. Or they said that acetaminophen can enter the liver, either the child's or the mother's, and start to break down there, producing certain hormones and enzymes during its breakdown. These enzymes can inhibit the growth of brain cells. Or they said that acetaminophen inhibits the secretion of the hormone testosterone in children, which is very influential in the development of brain cells, or that it can damage the DNA of body cells and cause harm to brain cells. Of course, I should tell you that these particular studies and the methodologies suggested by various researchers have not yet been fully and completely confirmed, and much more extensive research is still absolutely needed to make sure that what these dedicated researchers are saying is truly accurate and genuinely effective,
Which is basically commonly known as Tylenol. During the period of pregnancy, there can be a very significantly increased risk of developing autism. Therefore, the act of taking Tylenol during this crucial developmental stage is generally considered to be not advisable. All right, I'll say it. It's not good. For this reason, it is strongly recommended that women limit Tylenol use during pregnancy unless it is medically necessary.
So far, everything I've said has been the opinions of researchers who are convinced that there is a direct link between acetaminophen use and the occurrence of autism in children. And Trump has also referred exactly to these opinions. But in your opinion, how reliable can these views really be? The point is that these studies are kind of one-dimensional. That is, they only looked at the mother's history of acetaminophen use and concluded that since the mother took acetaminophen, the child's autism must be because of that. But I have to tell you that according to the opinions of researchers and scientists who conduct studies in the field of obstetrics, it has been shown that there is a direct link between the occurrence of autism and the mother's infectious disease. This means that if a mother contracts an infectious disease, a fever-inducing illness, it's possible that her child could develop autism, and maybe the mother took acetaminophen just to control the fever caused by that illness, and it was actually the infectious disease that led to this problem. On the other hand, researchers conducted a study in Sweden in 2025 where they examined about 2.5 million children to see whether there is a connection between autism and acetaminophen use. At first, they observed that this connection does exist. But when they examined the siblings of these children, who have a similar genetic background and similar environmental background, they found that there was no connection and concluded that there is no link between acetaminophen use and autism. Also, the results of this study were confirmed in another research conducted in Japan, which involved 200,000 children. The final conclusion was that there is no link between acetaminophen use and the development of autism, and that genetic factors are a more significant influence on the occurrence of autism.
All pregnant women should talk to their doctors for more information about limiting the use of this medication.
The reaction of scientific communities to these statements was varied. The WHO, or World Health Organization, stated that there is still no confirmed research on this matter, and therefore there is no established link between acetaminophen use and the development of autism. The FDA said that there may be a connection, but it has not yet been fully confirmed, and it is recommended to consider the medication as one that could potentially cause autism. The strongest reaction came from the American College of Obstetricians and Gynecologists, which stated that absolutely, in the past 20 years, no proper research has been conducted on this matter, and there is no connection between the occurrence of autism and the use of acetaminophen.
But with Tylenol, don't take it, don't take it. And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly, first question, what can you take instead? It's actually, there's not an alternative to that. And as you know, the other medicines are absolutely proven to be harmful. I mean, they've been proven to be harmful, like aspirin and Advil and others, right? And they've been proven to be harmful.
So considering these conflicting opinions, should we use acetaminophen or not? According to the protocol of the American College of Obstetricians and Gynecologists, having a febrile illness and infectious disease is directly linked to the occurrence of autism in newborns. So, a mother's fever must definitely be controlled and her infection treated. On the other hand, taking aspirin or ibuprofen has irreversible and serious risks for the fetus, and under no circumstances should we use ibuprofen or aspirin during pregnancy. The only safe medication we currently have available is acetaminophen. However, it is recommended not to use it during the first trimester. Since the baby's organs are forming during the first trimester, it should not be used then, and we should avoid using this medication for a long period or in high doses. In other words, we should avoid both excess and deficiency. We should use it for the proper and short duration at the appropriate dose and always under a doctor's supervision. Well, if I want to summarize what I've said, I should mention that currently the safest medication we have is acetaminophen, and for now we can use it during pregnancy. However, its use must definitely be under a doctor's supervision in low doses and for a short period. I hope the things I discussed in this video have been helpful for you. I kindly ask you, if you haven't subscribed to my channel yet, please make sure to do so, and don't forget to like the video. And if you have any questions about the video I posted, be sure to write them in the comments so I can respond. Until the next video, stay safe and healthy.